Assalamu alaikum dear students, welcome to Dr. Rumi Lectures. Today we are going to have our very first session from hemostasis, which is chapter number 37 from Guide and Physiology. So what is hemostasis? The word hemo means blood and stasis means standing. Hemostasis is cessation of blood loss from a damaged vessel. So if a blood vessel is cut or damaged, then there will be loss of blood from this vessel. So prevention of this blood loss or stoppage of this bleeding is called as hemostasis. This word hemostasis should not be confused with the word homeostasis, which is maintenance of internal environment within a constant range. For example, regulation of your body temperature, regulation of blood glucose level, blood calcium level, they are all examples of homeostasis. But the word hemostasis is stoppage of bleeding after a vessel is damaged. Why hemostasis is important? If there is some minor bleed within our skin, there will be some bruises which may be small or bigger in size. However, if some bigger vessel of the body is damaged and if there is some external bleeding or internal bleeding, then this too much loss of blood can cause hypovolemia and the person can go into circulatory shock or hypovolemic shock, and this can cause organ failure of the person and then eventually death. So this is why it is important to have hemostasis or stoppage of bleeding after a vessel is damaged. Now let's talk about the steps of hemostasis. We need four mechanisms for hemostasis to occur. First one is vasoconstriction, which means that as soon as there is injury to a vessel, there will be spasm of the vessel and this will decrease blood flow from the damaged vessel. Number two step is formation of a plug which is called as platelet plug. This platelet plug is a temporary plug, it's weak, and this is also called as primary hemostasis. Platelet plug formation is followed by the third step, which is called as blood clotting or blood coagulation. This clot is formed by fibrin threads. It's more stable and unyielding clot as compared to platelet plug, and this is also called as secondary hemostasis. And later on, due to clot retraction mechanism, this blood clot will become further strengthened. The fourth step is clot organization. This is because of fibroblasts which make collagen fibers. So within several days to weeks, there will be organization or growth of the collagen fibers within the clot. And once the healing has taken place in the vessel, then this clot may be removed, and that process is called as clot dissolution or fibrinolysis, and this is the function of plasminogen. So if I ask you this question, which blood cells are most important for hemostasis? The answer is platelets, also called as thrombocytes. So the major role of the platelets is in the platelet plug formation, but they also play their role in the first step, which is vasoconstriction, and also in blood clotting process. Now let's discuss the very first mechanism of hemostasis in detail, and that is vasoconstriction. So how does this process of vasoconstriction occurs? As soon as there is damage to this vessel, let's suppose this vessel has damaged here, and because of damage to this vessel, there is loss of blood. So blood is being lost. What will happen? There will be immediate constriction of this vessel wall, and that will decrease the diameter of vessel. Then there will be less flow of blood in this vessel and less bleeding will occur. This vasoconstriction or vascular spasm is directly proportional to the trauma to this vessel. If there will be less trauma to the vessel, there will be less vasoconstriction, and in case of a bigger trauma to the vessel, there will be more vasoconstriction. This vasoconstriction lasts for minutes to hours, and the purpose of this vasoconstriction is that it decreases the blood flow so that enough time is given for the platelet plug formation and blood clotting to occur. So what are some factors which cause vasoconstriction? The first thing is when there is damage to this vessel wall, you know that under the endothelium there is subendothelial collagen fibers, and then is the layer of smooth muscle fibers. So after damage to this vessel, when these smooth muscles in the vessel wall they are damaged, there is intrinsic mechanism in the smooth muscles which causes them to contract. So this local myogenic contraction of the smooth muscle fibers after they are damaged will cause the diameter of this vessel to decrease because of the spasm, hence the blood flow will decrease. Second mechanism is because of damage to this vessel wall, there are nociceptors or pain receptors which are stimulated. So you can see here, these nerve fibers, they are having the free nerve endings. So these free nerve endings, they are directly affected by the trauma, and also some local chemical factors which are released here, they also stimulate these endings of the nerve fibers. So in response to pain, there are reflex mechanisms which cause this vessel to constrict. And then there are some local chemical factors here which play their paracrine role. And important of those chemicals here are serotonin. Serotonin is released from damaged endothelium and also from the platelets. And also endothelin. Endothelin is a very powerful vasoconstrictor factor which is released from the damaged endothelium. And also thromboxane A2 which is released from the platelets. And epinephrine as well. They are all released after there is damage to the endothelium and also the underlying tissue and also from platelets. And these chemicals, they play their role locally. They act as local paracrine factors and they cause powerful vasoconstriction and hence decrease the diameter of this vessel, decrease the flow of blood and decrease bleeding. Another important mechanism which can decrease bleeding from a damaged or ruptured blood vessel is the contraction of surrounding smooth muscles. For example, in case of uterus after childbirth, the surrounding smooth muscle fibers of the body of uterus, when they contract, they compress on the blood vessels. I'm not talking about the smooth muscles which are present in the wall of blood vessels, rather the smooth muscles which are present in the body of uterus. So when there is birth of the baby, then those smooth muscles in the wall of uterus, they contract and hence there is compression on the wall of blood vessels and that decreases bleeding. This process of contraction of the wall of uterus can occur naturally by oxytocin, or it can also be augmented by some drugs which have oxytocin like effect, and in this way the hemorrhage after birth of baby can be decreased. For bleeding to occur from a vessel, there must be some cut here, and also there must be some pressure difference between inside of the vessel and outside of the vessel. So if there is more pressure inside of the vessel as compared to outside, this blood will be lost from in to outside. However, in some tissues, if bleeding accumulates outside of the vessel, and if there is enough blood which has been accumulated here, that will have a back pressure on the wall of vessel, and that can decrease further bleeding. This degree of compression because of accumulation of blood out of the vessel, it depends upon how distensible a tissue is. So if a tissue is less distensible, there will be more compression by this blood which is accumulating outside of the vessel and that will stop further bleeding. But in some tissues which are more distensible, for example below our eyelids, more bleeding can occur and it can lead to black eye if there is trauma to our eyelids. In case of medium to large size arteries, if there is damage to the vessel wall, there is profuse bleeding. Why? Because in arteries there is more pressure inside of the vessel as compared to outside. So this is why in case of arteries, just this vasoconstriction mechanism is not good enough to stop the bleeding completely. Hence, we need to compress on this medium to large size vessel so that the bleeding can be stopped. And what about medium to large size veins? In that case, there is less bleeding from the vein because veins have less pressure inside, and the bleeding from veins can be stopped by raising that part of the body against gravity and also by slight compression on the vein which is damaged. So just to summarize, vasoconstriction or vascular spasm is the very first event, a very first step in the hemostasis. This occurs immediately after there is trauma to the vessel wall, and this occurs because of damage to the smooth muscles, which cause myogenic spasm of the vessel, hence decreasing the diameter and decreasing the blood flow. Secondly, this also occurs because of stimulation of the pain receptors or nociceptors, and they cause reflex contraction of the smooth muscle in the vessel wall. And thirdly, there is contraction of the vessel wall by local factors which are released here and have paracrine effect. For example, serotonin, endothelin, thromboxane A2 and epinephrine. Serotonin and thromboxane A2, they are released from the platelets. Endothelin is released from the damaged endothelium, and all these factors, they cause vasoconstriction. The purpose of this vasoconstriction is to decrease the vascular diameter, decrease the blood flow and decrease the bleeding so that enough time can be given for the platelet plug formation and blood clotting to occur. This vasoconstriction alone cannot completely stop the bleeding after damage to the vessel, but it can reduce bleeding. We need the second step, which is platelet plug formation, to completely stop the bleeding. However, the second step, which is platelet plug formation, is a weak plug. it should be strengthened by the blood coagulation, which is the third step. Now let's talk about the second step of hemostasis, which is platelet plug formation. The first step was vasoconstriction. The second step is platelet plug formation. This platelet plug formation is also called as primary hemostasis. It's a weak plug. Platelets, they are small fragments which are present in our plasma, and they are made from megakaryocytes. The diameter of platelets is just 2 to 4 micrometers, and their number is about 150,000 to 350,000 per microliter or per millimeter cube. When there is damage to this vessel wall, platelets from the vascular lumen, they come and attach to the collagen which is exposed here. You can see here just below the damaged endothelium, there is collagen here, subendothelial collagen. So platelets come and attach here to this collagen. Why normally platelets do not attach with the vascular wall? It is because the vascular endothelium, which is smooth, repels the platelets. So how does the attachment of platelets from the blood takes place here? If let's suppose this is a platelet, it will come and bind with the collagen. So how does this attachment occurs? It is because of a protein which is called as von Willebrand factor. So that von Willebrand factor will act as a cement substance. Here this is von Willebrand factor. This will attach with the collagen, and then platelet will come and attach here. So platelets bind with glycoprotein 1b receptor with the von Willebrand factor, which act as a cement substance, a bridge in between the platelet and collagen. Once this platelet has bound with the collagen fiber, it is activated. This means that now the platelet, it will form its processes which are pseudoport like processes, and platelet will change its shape. That is, there will be some conformational change, and platelet will become star shaped. Once this platelet is activated like this, it will release some factors, and some of those factors, they are ADP, thromboxane A2, and platelet activating factor. The formation of platelets and then its star shape is because of the action of some proteins, actin, myosin, and thromboxane, which are present inside the platelets. And these chemicals, they are released from inside the granules. Actually, thromboxane A2 is released from the arachidonic acid from the phospholipids of cell membrane. But this ADP and also von Willebrand factor and platelet activating factor, they are released from the granules from inside of the platelets. So what is the action of this ADP or adenosine diphosphate? It will activate more and more platelets. So how this will happen? This ADP will induce the expression of a receptor on the surface of platelet, and that receptor is called as glycoprotein 2b3A receptor. So ADP will act on its receptor, and hence it will increase the expression of this receptor glycoprotein 2b3A. And because of expression of these receptors, the platelets becomes sticky. And in this way, more and more platelets, they can bind with each other. And then the bridge in between will be fibrinogen. So it means this platelet is also having glycoprotein 2b3A receptor here. This one is also having glycoprotein 2b3A receptor on this platelet, and in between is fibrinogen, which act as a bridge. You can see here platelets bind with the subendothelial collagen by the bridge, which is von Willebrand factor, which is released from the alpha granules of platelets. And here one platelet will attach with the other platelet by the bridge in between, which is fibrinogen. So in this way, when more and more platelets, they are being activated, so platelets convert into star shapes, which means they have a lot of pseudopods, and in this way these platelets, they start accumulating here. So there are three steps in the platelet plug formation. First step is the adhesion of the platelet with the subendothelial collagen. And after that, there is activation step, which means they release more and more ADP and thromboxane A2, which activate more platelets, and hence they become sticky. And then they attach with each other. Third step is aggregation of platelets. So first one is adhesion of the platelets with subendothelial collagen, and second step is their activation by ADP and reinforced by thromboxane A2. And then third step is once these platelets are activated, they will aggregate together to make a platelet plug which will stop bleeding. So in this way, when more and more platelets they are activated, they come and adhere to the previously activated platelets. This is a positive feedback mechanism which will make enough plug here that it will act as a physical barrier to stop any bleeding from this vessel. And the time taken for this platelet plug to form is called as bleeding time. By Duke's method, this time is about 1 to 3 minutes. And in all those conditions in which there is less platelets in our blood, that is thrombocytopenia, this bleeding time will increase. And also in those conditions when someone is taking aspirin, which decreases the production of thromboxane A2 by inhibiting the cyclooxygenase enzyme, that also decreases the function of platelet, and hence the bleeding time will increase. So we can see here that aspirin, which is non-steroidal anti-inflammatory drug, this can irreversibly suppress this cyclooxygenase enzyme, and hence it decreases the formation of thromboxane A2 from the arachidonic acid. Arachidonic acid is a fatty acid which is released from the phospholipids in the cell membrane of the platelets. When there is less formation of thromboxane A2, there will be less activation of platelet, and hence the platelet aggregation process will be decreased. This is why usually in cardiac patients 75 milligram of aspirin is given daily to decrease the possibility of thrombosis. Sometimes you may be asked this question in examination: if platelet plug formation is a positive feedback mechanism, why this platelet plug formation does not step to the other part of the vessels, and why this don't continue? The answer to this question is that this is only occurring at the point where endothelium and the other blood vessel wall has been damaged. But where the endothelium is intact, that endothelium is producing chemicals like nitric oxide and also prostaglandin I2, which is also called as prostacyclin. These two factors, they are very important vasodilators. They prevent the aggregation of platelets to the normal endothelium, and hence it prevents the platelet aggregation. And this is why this platelet plug formation, which is a positive feedback mechanism, it is stopped by the negative feedback mechanism, and it does not spread to the normal adjacent lining of the endothelium of the vascular wall. Because this platelet plug which has formed here, it is a weak and fragile plug. This is why this is a very important clinical rule, that when some bleeding has just occurred in the tissue, for example during surgery, we don't just wipe away this blood. Rather, we use a dry towel to just tap this blood from here by the capillary action of the dry towel. But we don't wipe it away, otherwise this weak platelet plug will be removed and then bleeding can occur again. What is the importance of these weak platelet plug formation in our body? Actually, in our small vessels like arterioles and venules, thousands of minor traumas, they are already going on, but we are not aware of it. And all those small traumas to our arterioles and venules can be easily plugged by this platelet plug formation, and this way bleeding will not occur. If there is deficiency of platelets, or if their function is not normal, then what can happen? The trauma which occurs to our arterioles and venules, that cannot be plugged by this platelet plug formation, and hence bleeding will occur, which will look like purple or red small dots in our skin, which can be called as pinpoint hemorrhages or petechial hemorrhages, and very specifically this is called as purpura. And because this usually occurs because of deficiency of platelets, we call it thrombocytopenic purpura. This can occur in our skin and also in our mucous membranes. Clopidogrel is the name of a drug which can be given to block the receptor for ADP, which is also called as P2Y12 receptor. So this drug, just like aspirin, can be given to those patients who are at risk of developing myocardial infarction because of thrombosis. Abciximab is another drug which can directly act on this receptor, which is glycoprotein 2B3A receptor, and in this way this can decrease the aggregation of platelets, because this receptor, when it is directly inhibited by the action of abciximab, it cannot link one platelet with the other platelet through fibrinogen, and this way platelet aggregation will be decreased. There is a disease which is called as Glanzmann thrombasthenia, and in this disease there is deficiency of glycoprotein 2B3A receptor. Hence, because of deficiency of this receptor, platelet aggregation is decreased in these people. Von Willebrand disease is the most common hereditary bleeding disorder in which there is deficiency of this protein, von Willebrand factor. Von Willebrand factor is a glycoprotein which is released from the alpha granules of platelets. If this protein is deficient, this person will have bleeding disorder, and this is one of the most common hereditary bleeding disorder. So once this platelet plug is formed, initially this is a weak plug. After this platelet plug is formed, actin, myosin and thrombostatin proteins contract. This contraction of contractile proteins is responsible for further strengthening the clot. The activated platelets in this platelet plug also release some very powerful vasoconstrictors like serotonin, thromboxane A2 and also epinephrine, which are responsible for causing further vasoconstriction, and that further decreases the diameter of the vessel and hence further decreases the blood flow through this damaged vessel. Another very important function of this platelet plug is to release some procoagulant factors like calcium, like clotting factor number 3, like clotting factor number 13, which are very important to make blood clot, which is a very strong, unyielding plug. And that is very important to stop bleeding completely from larger holes in the vessel. So we will study that blood coagulation or blood clotting process in our next lecture. Thank you so much for watching this video. See you next time with another video.